Okay, so we'll discuss now how to actually mobilize. Right. So let's say there was a flexion dysfunction. Just kind of refresh your memory. You did your flexion PIM assessment here, right? And the key is, whenever you have limited flexion, you should ask yourself, well, is it limited left side bending or right side bending? So once you find a limited flexion, is it for side bending this way or side bending the other way, right? Because that tells you which way we need to mobilize, right? So, for example, right, the way you mobilize is very similar to the way you assess it, right? So let's say I put my finger on this segment here and I realize that I had limited flexion and side bending. So I flex into the motion, and then I make the bottom leg straight, okay? And I keep it just here. By having this leg bent here, right? Look at which way I'm side bending. I'm side bending to our right. So this person here, I had a limited flexion and right side bending. Okay. Other hand, palpate the segment, grab the arm, pull down into you. This motion here facilitates a flexion motion. Put your hand underneath your head, and then go underneath the arm here, and then you hold the segment. Right? Now here's a very important part, right? You have to log roll the pressure towards you. Okay? If not, you'll be all over the patient here and you'll lose power. So you log roll the pressure, okay? And then you do alt control delete. So alt means what? Alternate the top, alternate the bottom. Your top hand is control the superior segment by pushing the superior segment down, which facilitates the rotation. Then my hand over here, right? Alt control delete means mobilize and delete the pain away, right? So you see here when I put my hand, it's pulling to flexion and into side bending, right? So I'm just doing this type of motion here just to mobilize, right? You do the same grades like you learned before. Grade 1, grade 2 is you don't hit the end range. Grade 3, you hit the end range, you back off. Hit the end range, you back off. Grade 4, hit the end range there, and you stay there. Okay? Stay there. Okay? And then you stop after 30 seconds or a minute, and then you reassess. Okay? And that's how you do flexion mobilization. Okay? The key is really locking up from above and below, controlling the segment, and get your right line of pull.